What is Parkinson's disease, and 7 things you should know about this disease? Most people have already heard about Parkinson's disease, and many have a good idea of its symptoms. However, very few people know the causes, treatment, and different stages of Parkinson's disease. In today's video, we will be going over what Parkinson's disease is. Not just that, but also 7 things that we all should know about this progressive illness. But first, let me explain why everyone needs to be aware of the symptoms of this disease. The disease is so prevalent that nearly 1 million people in the US suffer from it. Moreover, approximately 50,000 new cases are diagnosed each year. Doctors suggest that there may be even more cases since the illness is often misdiagnosed. This is the reason why we need to spread awareness about Parkinson's disease. What is Parkinson's disease? It is a degenerative neurological health condition that primarily impacts the movement of the patient. To clearly understand what Parkinson's disease is, you need to know what dopamine is. Well, it is a chemical in your brain that is responsible for smooth and coordinated muscle movement, and it is produced in the substantia nigra region of your brain. When a person is impacted by Parkinson's disease, their cells of the substantia nigra start dying. As a result, dopamine levels decrease. According to experts, the symptoms of Parkinson's disease begin to appear when the dopamine levels have dropped 60 to 80%. It is worth noting that this illness is chronic and worsens over time. Now, we will discuss the 7 most important things that you should know about Parkinson's disease. Number 1. Symptoms. First of all, we need to learn about the symptoms of this brain disorder. The signs can be different for different people. Here, it is worth mentioning that the early signs are usually mild. Some people might not even notice them. However, they begin to worsen over time. Moreover, the symptoms of Parkinson's disease usually start impacting one side of the body. And even after the symptoms start affecting the other side of your body, they remain worse on that side. The symptoms of Parkinson's disease include tremors, rigid muscles, impaired posture and balance, writing changes, and slowed movement. The tremor usually starts in the limbs, such as your hand or fingers. Over time, this disease slows the movement of the patient, which makes it difficult for them to perform simple tasks such as walking or writing. It might become hard for you to get out of your chair, and your steps will become shorter when you walk. The slowed movement and limited range of motions are partly due to muscle stiffness, which also causes pain. Furthermore, if you notice changes in your speech, it might also be a signal of Parkinson's disease. You might start speaking softly, quickly, and sometimes patients hesitate before talking. In most cases, doctors look for 4 classic symptoms, which are unstable posture, slowed movement, muscle rigidity, and tremors. Number 2. Causes. As mentioned, it occurs when nerve cells in the substantia nigra become impaired. However, scientists still don't know what causes these cells to die. Furthermore, patients also lose the nerve endings that produce a chemical called norepinephrine. This chemical is considered the main chemical messenger of the sympathetic nervous system, which controls several automatic functions of your body, such as blood pressure and heart rate. This loss of norepinephrine can help explain some of the non-movement symptoms like fatigue, changes in blood pressure, and reduced movement of food through the digestive system. Many scientists have concluded that this illness results from a combination of genetic and environmental factors. Many experts also believe that various viruses can trigger this disease as well. Researchers have identified groups of people who are more likely to suffer from Parkinson's disease. For example, men are 1.5 times more likely to develop the disease as compared to women. Discussing the race group, white people are more likely to get this disease than Asians and African Americans. Moreover, the symptoms of Parkinson's usually appear between the age of 50 and 60. And if you have a close family member who suffers from Parkinson's, there are higher chances that you might also develop this neurological disorder. Lastly, exposure to different toxins and experiencing head injuries are also considered the causes of Parkinson's disease. Number 3. 5 stages of Parkinson's disease. Since it is a progressive illness, the symptoms worsen over time, and doctors usually use the Hain and Yahr scale to classify the different stages of Parkinson's disease. According to this scale, the symptoms are divided into 5 stages. Stage 1. It is the mildest form, and you might not even experience noticeable symptoms. At this stage, symptoms are isolated to one side of the body, and they don't impact the daily tasks of the patient. Stage 2. Now, it can take several months, and in some cases even years, for a person to reach the second stage of Parkinson's disease. At this stage, symptoms such as tremors, trembling, and muscle stiffness begin to appear. Moreover, you might also notice changes in facial expressions. Stage 3. When a person reaches the middle stage, they are unlikely to experience new symptoms. Instead, the symptoms become more noticeable at this stage. Your movements will slow down, and you will struggle to balance yourself. However, you will still be able to maintain your independence. Stage 4. Until the third stage, you can complete your activities without much assistance. However, the progression to the fourth stage results in significant changes. You will not be able to stand without a walker, and living alone becomes dangerous. Stage 5. This is the last stage in which severe symptoms of Parkinson's disease make around-the-clock assistance necessary. In most cases, it becomes impossible for the patient to stand. Not only that, they start experiencing delusions, hallucinations, and confusion. Number 4. Treatment. Treating a patient with Parkinson's involves a combination of therapies, medications, and lifestyle changes. First of all, a balanced and healthy diet, regular exercise, and adequate rest are essential. Moreover, therapies such as speech therapy, physical therapy, and occupational therapy help improve communication. The medications used to treat Parkinson's disease include levodopa, dopamine agonists, anticholinergics, COMT inhibitors, amantadine, and MAO-B inhibitors. In approximately all cases, patients are required to use medication to help control various symptoms associated with Parkinson's disease. What if a patient doesn't respond to medication, lifestyle changes, and even therapy? In that case, doctors recommend surgery. The 2 primary types of surgery to treat Parkinson's disease are pump-delivered therapy and deep brain stimulation. Number 5. Parkinson's Dementia. The most common complication of this illness is Parkinson's dementia, which causes you to develop difficulties with problem-solving, reasoning, and thinking. In fact, 50 to 80% of people suffering from Parkinson's disease experience dementia. So, how will you know whether you have Parkinson's dementia or not? Well, the symptoms of Parkinson's dementia include changes in appetite and energy levels, slurred speech, mood swings, confusion, delusions, sleep disturbances, and depression. Here, it is worth mentioning that if a person previously had mood issues before they were diagnosed with Parkinson's, they are at a higher risk of dementia. Right now, there is no way to cure dementia. Instead, doctors usually focus on treating other symptoms of Parkinson's disease. Number 6. Life expectancy. Although it is not fatal, many patients die due to complications. When you have Parkinson's, you are at a higher risk of developing potentially life-threatening complications, such as blockages in your lungs, lung infections, blood clots, and a fall. Currently, it is unclear how much this illness decreases life expectancy. However, one study found that 64% of patients died within 6 years, and also 70% of people involved in this study had been diagnosed with dementia during the span of the study. Number 7. It isn't the same for all people. Now, not everyone suffering from this progressive illness experiences all of the symptoms that I have mentioned in this video. Furthermore, the order in which symptoms appear varies from one person to another. In fact, several experts say that this disease is a very individual condition and is not always easy to detect the presence of this disease at the beginning. Several health issues that patients report before they are diagnosed are not specific to Parkinson's disease. These health issues include depression, anxiety, loss of sense of smell, constipation, and a frozen shoulder. This is the reason why many organizations are working to not only spread awareness of Parkinson's disease among the general public, but also across the medical community. Final thoughts. As we have already mentioned that there is no cure for Parkinson's disease right now, and medications can improve the symptoms. So, it is important that we increase awareness about this illness and create a Parkinson-friendly community in all areas of life. You can also help us spread the message by sharing this video to the ones that can relate. That's all for today's video, and thanks for watching till the end. If you liked it, make sure to give it a thumbs up. Don't forget to share your thoughts with us in the comments section below. Lastly, if you have not already subscribed to this channel, subscribe to it and hit that bell icon so you never miss any updates. We will see you in the next video. Take care and stay tuned.